Hey everyone, and welcome to our Illuminate webinar 2. We're so glad to have you here today. We had a really big sign up for this particular webinar, and we're thrilled. I think highlighting the stories of people who are going through ALS and FTD and related disorders is so critical. We're just going to go ahead and dive right in because we've got a lot of things to cover today. North Star ALS is the independent science hub for the ALS community. We offer support to ALS families to connect with research opportunities, help contextualize research findings, and offer insights to researchers straight from ALS families. Welcome today. Just a few housekeeping things. This webinar will be recorded, so the recording will be available afterwards. Thank you so much for your pre-submitted questions. We're going to try to get to as many as we can that were relevant to today's topic. While we're chatting today, feel free to drop questions into the question box for the webinar, and we will try to get to as many of those as we can. And then we will try to connect with you by email afterwards if there are things that we can answer offline. We are going to be prioritizing questions that are relevant to today's discussions. And then some of your questions that we received in advance were very relevant to some of the other topics that we're covering in other places. So we'll try to let you know if that happens. I also wanted to say today's discussion is very personal. People are sharing their own stories. And so panelists might choose to not answer a question, which is perfectly fine. And so if we end up in a territory, panelists, where you're not ready to give an answer publicly, there's absolutely nothing wrong with that. I don't want to make anyone feel obligated to overshare in any way. I wanted to thank our sponsors and partners for all that they've done to support this program. Illuminate Precision Medicine is really here to talk about drug development in many different ways. Our last panel and our last 2 weeks were really focused on introducing the concept of more targeted therapeutics and biomarkers and things like that. These 2 weeks are focused really on the lived experience and how research impacts all of us. And then our next 2 weeks will be focused on the pipeline, the research pipeline that's active today. And then the last 2 weeks will be focused on looking ahead to the future. Today, it's my pleasure to bring to you all Lori Hermstad, Brandon Felt, Connie Becker, and Michael Wilson. I have my dear friend and board member from North Star ALS, Lori Larson-Heller, who will be helping me moderate. I will have her introduce herself in a few minutes. I just wanted to say a few words about these 4 folks who volunteered their time to be here today. I'm so incredibly grateful to them. I met Lori Hermstad as my husband was going through ALS through social media, I believe, and we have become good friends since then. I followed her daughter Jaci's story very closely as we were going through ALS ourselves. Her story went straight to my heart for a million different reasons. It's an absolute pleasure to have her here. Brandon Felt, I met, I believe, in 2024 at an event I was at representing End the Legacy, which was amazing. And Brandon is just a wealth of information. I learned so much from him that day. I had the honor of attending the Cure VCP conference a couple of weeks ago, where he is very involved on the development side. And it was just an incredible experience. And I learned so much from the VCP community, and it's a pleasure to have Brandon here today. Connie Becker, I met, I think, just right around the time my husband got diagnosed at an IMALS event, and we have been very close friends since. I'm so grateful to have her here today to share her story and her experiences with ALS over her lifetime. And Michael Wilson, the Michael Wilson, if you haven't heard of him, is absolutely amazing. Michael Wilson and I met on Twitter, as many of us do, in the rare disease community. But what I have loved about Michael is he is always for very strong science. And in a world where we're often discussing a lot about access, he's very focused on bringing better therapeutics into ALS. So with that, I'm going to stop screen sharing. And Lori Heller, I'd love for you to quickly introduce yourself, and then we'll go to our panelists.
Sure. Hi, everyone. Lori Larson-Heller. My husband was diagnosed with sporadic ALS in late 2018. passed away 18 months later in May of 2020. And prior to that, I was in the corporate world for 35 years, but this disease changed everything about me, and I wanted nothing to do with that anymore. So to keep it short, I'll just say I do anything and everything ALS related now to try to make a difference. I've swore that we will find cures in my lifetime. So I serve on lots of patient advisory committees. I'm a consumer reviewer for the CDMRP, Department of Defense. I raise money for ALS, legislative efforts, all things ALS. And I am currently a board member for Nadia at North Star ALS, honored to be in that role. And I'm honored to be here with this outstanding group of humans here today. So thank you for joining us.
Thank you so much, Lori Heller. And with that, we're going to go ahead and get started. And I would love to hear from our four panelists about themselves for a little bit. So, Connie, let's start with you. Maybe you want to give us a little background on Connie.
Sure. I am part of the Payne family. We have SOD1 ALS in our family. And I've lived with it my whole life. Throughout my family, we've had it in our family, I would say close to 100 years we've traced it far back as we can. We've lost 22 family to ALS, and we currently have 8 living with it, thanks to tofersen or Qalsody, which has really been a blessing to our family to be able to have that drug. We have I'm sorry, I'm losing my train of thought right now. We have had many family that have gone through so much to actually get to that point, through a lot of clinical trials that they've either tried to be part of and not been successful, either too far progressed or not far enough. But thankfully, through all of the family that a lot are not with us anymore, through all of their efforts, our family was part of finding SOD1. So that was huge. And we're grateful that we were able to get that as part of history and part of getting us closer to hopefully that cure that we all want someday. So that's a bit of my story.
Thank
you. Thanks for having me here.
We're so glad to have you here. Thank you so much. Thanks for being here and sharing about your experience. And Lori Hermstad, maybe we can hear from you next.
Thank you, Nadia, for including me in this important conversation. It is truly an honor to be here and surrounded by these extraordinary people and their stories. My name is Lori Hermstad, and I am the proud mother of identical twin daughters, Alex and Jaci, who both sadly lost their lives to ALS at just 17 and 26 years old. Our family story is a reminder that ALS doesn't follow a script. While it most often affects older adults, it can also steal childhoods, futures, and all the precious ordinary moments that should have filled a lifetime. It also doesn't just affect the person diagnosed. It forever changes everyone who loves them. Watching Alex and Jaci battle this relentless disease was the greatest heartbreak of my life. Although ALS became part of their lives, it never defined who they were. Alex and Jaci were daughters, sisters, friends, but they were our whole world. Even in the face of profound adversity, they continue to live with grace and purpose, inspiring everyone who knew them. My love for them is why I continue this vital work. I share their story and advocate for research so families can have more time together. I couldn't change what happened to my daughters, but I can help ensure fewer families endure what ours did.
Thank you so much, Lori. All right. Michael Wilson, we would really love to hear from you.
Hi, everybody. Thanks for having me. Yeah, I live in Oklahoma City with my wife, and our daughter is about to start her senior year of high school. So please wish us luck on all that excitement coming up. Also, I do apologize. It can be a little difficult to understand me with this beautiful ventilator on, but hopefully you'll get the gist of what I'm saying. My ALS story started in November of 2014. I had some muscle twitches in my right arm. I was under a lot of stress at the time, so I didn't really, think much of it. A few months later, it had spread to my left arm, my chest, my abdomen. So I knew there was something going on, but without any other symptoms to go along with it. We were hoping it was just benign fasciculation. So I know many other people have, have had similar experiences. About 2 years later, after that first symptom, I noticed a muscle loss in my right hand. And that was, of course, the moment that we were, not wanting to see. And we knew what that meant. But so a few months later, in February of 17, I was officially diagnosed with ALS. Mine's the sporadic version. I don't have any known family history. And I do know I have been extremely fortunate, to still be here this many years later. And that slower progression has kind of given us the capacity to do other things. So for me, getting involved in, research, advocacy, and really just helping other families kind of learn to live the best they can with this disease, has sort of become our focus. So that's the gist of it. So thanks for having us, and looking forward to the chat.
Thank you so much for being here and sharing your story, Michael. And Brandon, we'd love to hear from you. And I would, if you don't mind, giving a little overview of VCP disease as well.
Sure, absolutely. Thank you, everyone, for being here, and thank you, Nadia, and the North Star ALS team for having me. I have been the primary caregiver for my mother, who is affected by frontotemporal dementia caused by a mutation of her VCP gene for the last 11 years. I began being her caregiver in my freshman year of college. Which became an all-consuming job for the next 3 years to get her a diagnosis. And through that diagnostic journey, we recognized that this disease has been present in the last 3 generations of our family, affecting 9 family members. And the reason that this is VCP and frontotemporal dementia is relevant in this discussion of ALS is because researchers are understanding that ALS and FTD are related and have connections both in the clinical presentation, in the underlying pathology, and in the genetics. And VCP is a gene that causes both frontotemporal dementia as well as motor neuron disease, ALS, as well. And so we have families and patients who are affected by both conditions. Some individuals are affected by both. Some families have one individual who's affected by FTD and one who is affected by ALS. And the reason that is because VCP causes what's called a multisystem proteinopathy, which is just dysfunction in proteins in various parts of your body. And so it's been eye-opening to learn from researchers in the last 10 years about their increase in understanding of how these diseases are interrelated and how the heterogeneity, both in clinical presentation, presents an opportunity for us to come together as seemingly different groups, but are actually not that different, and are actually united by these different levels of shared genetics and pathology. So yeah, that's just a little bit, but thank you all for having me. And I'm so excited to be on the panel with all of you.
Thank you so much, Brandon. And I think in talking with you and in meeting some of the folks at Cure VCP and also in some of the advocacy that I've been involved in the last few years, seeing how these different diseases overlap and where they connect and where they separate is, I think, going to be critical in developing better therapeutics for all of us. And this group of people here, there's nobody better to highlight some of that. Lori Andre, we have you here on camera, and I'm wondering if we should have you just introduce yourself too, because we are all very much connected and facing the same here, and we can just turn this into one big conversation.
Did you want me to introduce myself?
Yeah.
Oh, okay. My name is Lori Andre, and I am a board member at North Star ALS. And my story is such that my husband, in the fall of 2016, was diagnosed with sporadic ALS. But as it turns out, he does have a genetic mutation that could cause ALS, but it is of unknown certainty. So we'll just take that for what it's for face value. He's been living a very full life, even after being diagnosed 10 years ago, but was symptomatic for a couple years prior to that. So really, he's been living with the disease for a good 12 years. I'm just honored to be here. I love our panelists. I love that we're getting to hear directly from people who are really impacted the most, either living with the disease or have lost a loved one with the disease. I'm just really, really interested in hearing what everybody has to say and sharing their experiences. So thank you.
Perfect. And I think from here, we'd love to just have this be a conversation. So I'm going to call on some of you, but please feel free to jump in as needed. And Lori Heller, feel free to unmute. You always have amazing questions and things to say. So one of the things that happened when we brought this group together initially to talk through what are we going to talk about on this webinar, we talked, we got to the definitions of sporadic, genetic, and familial ALS. And I was like, I'm just going to say those things and then we'll move on and we'll have our discussion. And then we even those three terms had so much nuance for these panelists. And so we're going to do a deep dive into sporadic, genetic, and familial. Let's see. Lori Hermstad, maybe we can start with you on what these terms mean to you.
Well, thanks, Nadia. When I first heard the terms genetic, familial, and sporadic, I thought I understood what they meant. But my first instinct was that, our daughter's ALS was sporadic because it seemed to come out of nowhere. At the time, Alex was a healthy 11-year-old, or so we thought. And that explanation, simply made the most sense. I assumed genetic meant inherited, familial meant that it ran in families, and sporadic meant it happened randomly. Since there was no history of ALS on either side of our family, I was convinced it had to be sporadic. But later, we did discover that it was genetic. And at first, I couldn't fully comprehend what that meant. As a mother, my first instinct was to wonder, did we do something to pass this on? Did we somehow cause this? And until we finally had answers, it was hard to overcome that feeling that somehow I'd failed my daughters. But what we eventually learned is that genetic doesn't always mean inherited. In Jaci and Alex's case, their FUS ALS was caused by a de novo mutation. It's a genetic change that occurs at conception. It wasn't something Jeff or I knowingly carried or passed on. So that knowledge did bring some scientific clarity and lifted an enormous burden of guilt, but it still could never lessen the heartbreak of watching them face this devastating disease. Looking back, I realized that these words, mean far more than their scientific definitions. They represent the questions families desperately need answered and the uncertainty they're forced to navigate. So today, when I hear those words, I don't necessarily think about their definitions. I think about everything a family carries after a life-changing diagnosis.
Thanks so much, Lori Hermstad. I think it's so hard to explain these concepts. And when we hear you just tell your story, it really comes through how complicated all of this is. Brandon, let's go to you next.
Yeah, so when you ask that question and I think about those terms, it immediately takes me back to our diagnostic journey where we were trying to put together the pieces of what is this disease that has taken my mom from being a productive, highly functional single mom taking care of two kids to being someone who our roles were reversed. And I became the parent and caregiver for my mom and my younger sister at the same time. Like, what is it that's causing this to happen? And so we knew that there was family history of some type of neurological or psychiatric condition, which we now know was misdiagnosed. It wasn't psychiatric, it was neurological as frontotemporal dementia. But really the understanding the genetics was something we were searching for 3 years, and we didn't know it. So we were just searching for the answer. And when we got that diagnosis of, oh, this is a genetic form that causes these symptoms and it explains your family history, it was a double-edged sword because it was a relief, because knowing was huge. Being able to name it is huge, but then it also opened up a whole can of worms within our family, within me and my sister. VCP is follows an autosomal dominant inheritance pattern, a lot like many of the genes that cause ALS and frontotemporal dementia, which just means you only need to have one copy of the gene mutation in order to present symptoms. And it also means that every child of an affected individual has a 50% chance of inheriting it. And so this, it really made my sister and I have to confront the fact of whether we were going to inherit this from our mother. And so I mean, we can talk about more about this later, but anyway, I have very mixed feelings when I think about genetics, and it's a good and bad thing all at the same time.
Yeah. So
Brandon,
Brandon,
can I? Oh, go ahead, Nadia.
Go for it, Lori.
Okay, I was just going to jump in and ask Brandon. So although there were other family members who obviously either were living with some condition or had passed from it, but you're saying that it wasn't until your mother's diagnosis that you actually realized it was a genetic condition?
Exactly. Yeah, my mom was the first to undergo genetic testing, and initially she'd done a small panel that didn't include VCP, and so we went ahead and did whole exome sequencing when that first panel came back negative because of the strong family history. But the family history was people diagnosed with Alzheimer's disease, which is very different from frontotemporal dementia, and then also other psychiatric conditions, which are the behavioral aspects of frontotemporal dementia, but they aren't the root cause of the disease. So once we had that genetic diagnosis, we were able to go back and put the pieces together that, hey, this causes a form of dementia that causes these behavioral changes and these things that our family members had.
Interesting. And what was your mom's age of onset? And is it typical for this VCP?
Yeah, so her onset age was 55. So that's when we really started to notice symptoms. However, there were probably things that we didn't recognize that occurred earlier than that. But it's been a gradual disease progression for her. And so it's been 11 years since 2015, or yes, 2015. And so right now she's not able to speak. She hasn't been able to speak since 2019. She is not ambulatory anymore, so she's 100% assistance with all of her activities of daily living. And so yeah, it's been very challenging, like I mentioned previously, having our roles reversed. And
For sure. Thank you for sharing that.
Of course.
Great questions, Lori. Brandon, I'll just add one additional question. With VCP, because it can appear in so many different ways, does that make it more complicated for families to identify? Did it make it harder to understand the genetics I mean, in your family, it seems like there was a similar pattern that happened, but VCP can manifest in many different ways.
Yes, so it does make it very challenging to make the familial connection between people who have the disease, because it can present as frontotemporal dementia, as ALS, as another muscle weakness disease called inclusion body myopathy, and there's a bone disease called Paget's disease. And so different family members can have one of these presentations, which will look very different from each other, and yet it's caused by the same gene and the same pathology. So it makes it very difficult to get a diagnosis, and also, very, very difficult to identify within families.
Yeah, somebody has to make that connection that these are all related things potentially. So thank you so much for sharing your story. Michael, let's go. Lori, Andre, you have.
Oh, no, I just had a quick question. So that the gene that your mom and your sister inherited, correct me if I'm wrong, but could that also cause Paget's disease?
Yes. So my sister and I have not been genetically tested, so
Oh,
we don't know our status yet.
okay.
But this gene, if an individual has it, it can cause Paget's disease of bone, inclusion body myopathy, FTD, and ALS. So an individual can have all of the presentations or just one.
Right. The only reason why I bring it up, and I think Nadia, was a very interesting point, is that so my husband was diagnosed with a genetic mutation SQSTM1, which can also cause Paget's disease, which my father-in-law has. So he has Paget's disease. My husband got ALS. They don't know if they're necessarily, if it's the gene that caused the ALS. They know for sure that it can cause Paget's disease. I'm just wondering, if they identified other genes that also can cause Paget's disease, like why all of a sudden are we hearing so much about Paget's disease related to some of these rare genetic mutations?
Yeah, do you want to speak to that, Nadia, or would you like me to?
Oh, go for it, Brandon.
So this is a really like an fantastic question, Lori, and a fantastic observation, because what researchers are understanding is that these gene mutations have the potential to affect different tissues, and so they're thinking about them in a different framework, which is as a multi-system proteinopathy, and so a lot of these different genes are brought together by the fact that they affect different tissues in different areas. So Paget's and ALS and FTD, there is a relation between them, and it's hard to make that connection. That's not common. If you're affected by ALS, why would you think that a family member with a bone disease has the same cause? And so it's an excellent question. Nadia, is there anything you want to add?
Yeah, and I think this is why I talked, I've been very vocal within the community for so many years, and I've talked to so many people with what are so-called ultra rare or rare mutations, and we're gonna have to take every single one down one by one if we're going to solve this. And that's why I think it is so important to have these discussions, right? It is about what is the thing that's going wrong in that disease that's causing the multi-system proteinopathy. Where is the overlap between that and SQSTM1? Where is the overlap between that and sporadic ALS and other forms of genetic ALS? I think one of the things that really struck me at the Cure VCP meeting was how much of it was dedicated to TDP43, and I was sort of blown away because that's such a major target in ALS. But and ALS doesn't make up a huge portion of VCP, and it's not present in everyone, right? And so we are going to have to. That's why we're having these conversations, so that we can start drawing attention to where we're similar and where we're different. And so I'm glad that we're discussing today. All right, Michael, let's hear from you on the.
That's just fascinating stuff, Brandon. Thanks for sharing all that. And on Lori H's point, like these labels, they're not just scientific labels, right? They kind of help shape how we view our disease. So when I was diagnosed with sporadic ALS, at the time, it felt like an answer. It kind of told me, what was happening to my body. As I kind of learned more, I realized it was less of an explanation and more of just a description that says, we don't know what's causing ALS. We don't know why you have it. So to me, sporadic kind of feels like it's all of the leftovers that we haven't identified yet. And I say yet because I do think we are going to, continue finding the biology of ALS. And in doing so, the number of people with sporadic label will get, shifted into other subcategories. And we're kind of seeing that a little bit now after the approval of tofersen. There were a lot of people that have sporadic ALS for years who, decided to get genetic testing done. And in doing so, realized they actually have a genetic variant. So they kind of moved from the, sporadic label to the, appropriate genetic category. So I think as we continue to learn more of that, sporadic will become fewer and fewer.
Yeah, Michael, when you say sporadic is the leftovers, it just goes straight to the heart, right? Because that's kind of what we hear from a lot of the community is how do we start understanding what the differences are? I think that we also had a little bit of discussion about not just the genetics, but how differently, ALS and these diseases can present. And that applies, just to ALS and ALS research as well. And we can talk a little bit more about that. But do you have, I remember you brought up heterogeneity in the past and how that can manifest, in physical symptoms. And maybe you want to speak to that a little bit.
Yeah, I mean, it's wild that, I can still speak after 10 years with ALS. That's pretty much the only, muscle movement I have left. But there's other people that have lived with it for about 10 years who can't speak at all, but still have, limb movement. So it's just so much to understand about how we can have the same diagnosis and different symptoms that present. And is it a biological thing that's how that different, you know, presentation of symptoms, or is it something different? So I think that's where the research is, hopefully heading.
Yeah, I think we're not seeing a lot of research even making those distinctions at the beginning, right? Like how was the onset and then things like that, where it might make a difference in the therapeutic in some cases and not in some. But I think you made a really good point, which is why I'm pushing on that again today. Thank you so much, Michael.
Yeah.
Connie, let's hear from you on this terminology.
Well, I mean, I find it all fascinating in a way, but to Michael's point, I think even about onset and progression, and I mean, that's like the $1 million question, right? Even within our family, it's like as siblings or first cousins or what a parent to child, like how the progression differs. It's just fascinating. So that's always, why is it one way for one and so different for another? I just think if they can figure that out, I mean, that would be such a huge, a huge step in research for sure, and just answering a lot of questions. But being an SOD1 family, we have our genes, so now, they're able to test right away. And also, it's a 50-50 chance from the parent. If the parent has it, it's a 50-50 chance whether the children will get it. And unfortunately, my mom, it's on my mom's side of the family. She was a pain. And while she lost her dad, who was one of 6 brothers, of those 6 brothers, 4 had it and passed of it. And her dad was one. And then she had 2 brothers that sadly passed as well. And then 2 nephews that also passed. And then it seems she didn't get it. So it's wild, that how 2 brothers and she didn't. And then I was tested and I do not have it either. So, it's just, you wonder in certain families, within our own family, why some had it and some didn't. And we used to think it was all men in our family for the longest time until we realized it was more men born than women. Like I said, my grandfather was one of 6 brothers. There was no women. So, you just, and then that's been male dominated until it wasn't. And there was women born and then they've had it sadly. So, there's just no rhyme or reason to any of it other than whether you have it or not in my family is how it worked. So.
Connie, and you don't have to answer this, but do you want to share a little bit more about your mother? You know, maybe what her life was like because she was surrounded by this disease.
Yeah, it was, I didn't even know the disease was in our family. So she lived a lot of it without sharing it with me. And she was pretty private. And I know she was close with her father and her oldest brother and her younger brother. So, she lived her whole life believing that she was going to have ALS. I mean, that was just what she thought, and to the point where she was so adamant that I never be tested. We were always told to never be tested. It was kind of like the slogan in our family. And then ultimately she passed of stage 4 cancer 5 weeks after her diagnosis. And when she was diagnosed with cancer, she kept saying to the doctor, it couldn't possibly be cancer. It was wrong. It had to be ALS. Like there was no way it could be ALS, or it could be cancer. I'm sorry. It had to be ALS. That was, and this poor doctor couldn't imagine why she would want ALS over cancer, not that she wanted it, obviously, but she just couldn't get her head around the fact that it was cancer, because she knew how to do ALS and she had no idea how to do cancer. And then for her to pass in such a, horrible way too, and so quickly. So, which was a blessing for her. She had seen so many of our family suffer. And it was really tough. Survivor's guilt is a real thing, for sure. And it weighed heavy on her. She passed at 66, so she was very young still. So, yeah, it was tough on her, as it is for a lot of my family. I mean, that are still living and having dealt with it. We lost a lot of very good people in our family, for sure.
Hey, Nadia, now might be a good time, as our panelists are talking about these descriptions. Candy in chat, and Candy, I want you to know you're not alone, including me, because her question is, can you explain the difference? And I'm going to leave this one to you, Nadia. Explain the difference one more time between genetic and familial, because Candy said, I've always used them interchangeably. And that's my message to Candy, is do not feel bad. Like for a long time, I did too, but maybe you could hit that one more time.
Absolutely. And I think after we had our practice panel, I got Connie smiling too, because a bunch of us had the discussions about like this and highlighting, all of these changes. And Lori Hermstad, you're smiling too, right? Because
Yes.
I'll say it, Connie called me after our last session and she was like, wait, what? So Lori Hermstad, maybe you can share one more time how a de novo mutation works and how it's genetic but not familial.
Well, I mean, like I said, from the beginning, I thought Jaci and Alex's ALS was sporadic because they were children. It came out of nowhere. It wasn't anywhere in the history of our families. And so thinking that it might be genetic, it was like the last, or even familial, what would be the last thought in what we would even consider. But years later, after discovering what Alex really initially had, it was discovered that her form, that she did have ALS, and her mutation was a FUS ALS, which is a genetic form. And it was a P525L, which is a juvenile form of ALS called a de novo mutation. And it happens at conception, which then classifies it as a de novo mutation. So it's still really, even though we lived it, it's still confusing to me. So, like I said, we struggled that this was something we passed on to our girls, but it wasn't familial. That, happens, in generations and whatever. If I'm saying that right. I might not even be saying that part right, but it was, the de novo is considered a genetic form of ALS, the FUS ALS that Jaci and Alex had.
Yeah.
Yeah, and I think maybe said differently but the same. It's possible to get a mutant gene that has not been passed down by either side of the family. So therefore it's not familial as it hasn't come down the line, right? So I'm with Lori Hermstad. That would have been devastating to think when they told me that my daughter had a genetic form of ALS, thinking it had to have come from me. But that we've all learned now that that is not the case, that there is genetic mutations that occur without it having been in the family line. So Candy, I know that that is somewhat confusing, but it is a very important distinction that I think we're all learning as we go.
Yeah, and I think one of the variations, I guess, that we didn't cover today, people can have familial ALS, but it may be sporadic, right? So there may not be any identified gene, but still multiple people in the family have had it. So there may be multiple genes at play. It can also just be by chance, potentially, although I know it doesn't feel that way. So all of these terminologies are really, there's a lot of nuance to all of this. Connie, do you have anything to add? I know we had a little bit of discussion on this as well.
Remind me, I'm sorry.
Oh, just on, the nuances between all of the terminology. Like, I think you and I had a discussion afterwards last time where we were like, kind of going back and forth playing with the terms. They're inadequate terms.
I mean, that discussion we had for the planning was so spot on because I always have referred to it as genetic and familial. Like I didn't know they were separate. So that conversation was enlightening as everything is. Like I've learned so much from this group and the pre-discussion, and even today I'm learning more. So, what you think you have an idea about with ALS, you don't. It's ever evolving, it's ever changing, and there's something new to learn all the time, which is good. That means progress is happening. But yeah, the genetic and familial absolutely threw me when I learned from you, Lori, about your story. So yeah, I had to dig a little deeper too, Candy. I didn't quite understand it all either. So I'm glad she asked it again.
Yeah, it's definitely a lot. And, somebody who has what seems like sporadic ALS could still have genetic ALS, and there may just have an unknown family history, which I think Brandon pointed out really well, as well with, the stories about VCP. So there's a lot of different reasons where genetics may not be obvious. Genetic mutations can spontaneously happen, like Lori Hermstad shared. And, for others, it's just been a part of their family always, as with Connie. And so it really highlights all of the differences. And then as Michael shared, there may not be any known genetics at all. And it doesn't mean that there's no genetics. It just may mean that there may be things that we're not identifying yet, whether it's a combination of things or not. And so these are all things that research will hopefully answer. And that's a good transition into our next discussion, which is on research. So Connie, you've talked a little bit about what it has been like to see research progress. Your family was one of the first where SOD1 was discovered. And so, there's a lot of people nowadays who consider people with SOD1 fortunate to have tofersen, and that is absolutely the case, but it was never that way always. And it's also not enough. So tell us a little bit about your family's experience, your experience with research.
Well, obviously, we are so fortunate and grateful to have tofersen. It's bittersweet too, because I have a lot of friends in the community and have had friends all throughout my advocacy. And I want everyone to have tofersen, as I know, everybody in my family does too. It's hard, but we are grateful for it. And, my family has gone through a lot too to try and get there. I mean, I've been to appointments with family in the past that would do anything to basically say, here's my body, do whatever you need to do. I don't want my kids to get it, or I don't want anybody else. And, it hasn't been enough. Their research wasn't where it was to be able to do anything. Like I mentioned previously, the trials weren't there, or their body was too progressed or not progressed enough, and there's all those things. So I'm glad research is moving forward, but obviously it's never quick enough. It's never quick enough. But the family that is on, tofersen now, it is a miracle for sure. But their bodies go through a lot too. It's not an easy. I love how they called it a lumbar puncture. I was laughing that it sounds like it's a massage appointment, and it's the furthest thing from that. They're injecting, or it's an injection into their spinal cord. I mean, it's not a fun time for sure. So, I mean, they're going through a lot every month, and for some, it takes a while to recover from. Again, so grateful for it. It's not a complaint at all, but it's not anything that's easy to go through. So I'm grateful for the research. It needs to go faster. We've come a long way though. Again, this has been a long time, and our family's gone through a lot to get to this point, as I know others have too. So there's a lot more still to be done. And I know a lot in my family are still willing to do whatever needs to be done, and, say, here's my body, and whatever you can do, I'm here for it. So that continues, which I'm grateful for. And I know others in my family are grateful for that as well, so the research just needs to catch up. Or I don't know how to say it. We're always begging for more research and to get closer to the cure.
It's moving, but it's not moving fast enough.
I know.
Michael, let's hear from you next. So you're living with sporadic ALS, and what has it been like to see the research landscape evolve? What do you think is missing for sporadic ALS?
Yeah, I think since I was diagnosed, research has definitely come a long way. 10 years ago, I don't feel like we had a lot of specific targets to go after. And a lot of trials kind of felt like a one size fits all, does this drug work on, people with ALS? And then fast forward to now, and we're looking much more closely at genetics, biomarkers. We have subgroups that, we can see if they're working on their trials. And then some of the biggest research that I think is happening now that's been missing is like the large observational studies, like all ALS. So I will plug that as many times as we can, because I think that's going to be like the pivotal work to really answer some important questions that we have about ALS. And so while we want everyone to have a targeted therapy, in the meantime, if one group gets something beneficial and others don't, I don't think that means like they're winning and we're losing. I think it's just we're finally having proof now that once we understand that biology, that we can then focus on a targeted therapy, and hopefully we'll get there sooner than later for everybody else.
Really appreciate your thoughts, Michael. Thank you so much. And Brandon, let's hear from you. We talked a little bit about the different ways VCP can show up. I recently saw an ALS trial that was specifically excluding VCP. I was sort of surprised. But what does research look like in the VCP community? Are people participating in ALS trials where they're applicable? Are they participating in FTD trials? What is the research landscape like?
Yeah, well, our goal at Cure BCP Disease, which I'm a part-time staff member for, started as a volunteer, joined staff part-time. Our goal is to encourage research opportunities for people affected by VCP gene mutations, and it's challenging for people to participate in research with ALS and the FTD phenotypes. It more difficult than those affected by Paget's or inclusion body myopathy. And so it's really, I mean, the heterogeneity, while it provides the opportunity to really pinpoint and narrow down like what that commonality is in the pathology, it also creates a lot of like difficulty in providing support to people affected, providing support to families. Like this is hard to explain, and it's not gonna, it doesn't sink in after one conversation. Most people are pretty confused by how the gene can cause so many different impacts. And so it, it's a constant education challenge. And it has been seen as a challenge in research as well, because when you're testing an interventional therapeutic, you typically want a trial that has endpoints or measures that are specific to the clinical presentation, right? So the old thought process around how you do a clinical trial really is insufficient when trying to develop therapies for these multi-system proteinopathy diseases. And so I don't have a great answer for what the perfect trial looks like when you're trying to develop a therapy for so many different people, but there's been a lot of approaches, and you could speak to this probably better than I can, just about novel approaches and ways to do that.
Yeah, I love it. No, I'm grateful that we have you here to share that perspective. Yeah, I think you know, figuring out who to include and the right drug for a mechanism that would be applicable in VCP and other types of, ALS is going to be a really critical piece. And so yeah, this is what we're here to talk about. Lori Hermstad, your family advanced FUS research so much. We talked about your story in more detail in a podcast that will come out in the next few weeks, where you really kind of did a deep dive into that. But for today, maybe you can give us a little overview of what it was like to be involved in that research process, and that science is still moving forward right now and it's impacting other lives today.
Well, thank you. Like in my head, when people think about maybe ALS research or like Brandon mentioned, they might think about scientific discoveries, the new therapies, or the clinical trials. But as a mother, I see something different. I see my daughters. Alex and Jaci were never trying to make history. They were fighting for their lives. Yet through the lives they lived and the gifts they gave, they helped change the trajectory of FUS ALS research. Research is built on science, but it is also guided by the people whose lives give it purpose. When Alex became sick at just 11 years old, the FUS gene hadn't yet been discovered. There was no genetic test, there was no targeted therapy, and there was no roadmap. We were desperately searching for answers that simply didn't exist. After she passed away, her donated tissue helped scientists gain critical insight into FUS ALS and helped lay the groundwork for future discoveries. So by the time Jaci was diagnosed with the very same disease, years of research had opened doors. And what happened next remains a powerful reminder of what is possible when scientific innovation is united with compassion and collaboration and a shared sense of urgency. Barriers that normally took years to overcome were broken down in just 4 months. Jaci became the first person in the world to receive a FUS-specific ASO treatment, initially known as Jaci Fusion, in her honor, and now carrying the name Ulefnersen. As a trailblazer for this pioneering therapy, her journey represented far more than a medical milestone. What began as a treatment developed for Jaci ultimately became the catalyst for an international clinical trial, and it also became an early demonstration of what precision medicine could achieve for FUS, contributing to a growing body of knowledge that continues to guide research and offer hope to families around the world. Alex and Jaci's lives remind us that behind every scientific breakthrough are acts of selflessness, generosity, love, and humanity. keeping their story alive is our family's way of carrying their legacy forward.
You know, I'm going to jump in, Lori, right now with we had Kevin Robinson on the chat. Want to say that, first of all, Kevin is someone living with ALS that we know well in the community, but he said, first of all, your story is heartbreaking. But second, do you have, I guess, what would your ideal research landscape look like in the future? And maybe that's hard to answer, but if you have an answer, feel free to throw it out. I know what I think you're going to say because as I
Sure,
think
can
about,
you help me out?
yeah, as I think about Jaci Fusion and how that has helped people and how that is now advanced into this phase 3 trial, it's very specific, right? But I know there's like 80 people in that trial, but wouldn't we all say that an ideal, as we talk about all these mutant genes and all these things, an ideal research landscape would have a targeted therapy for everybody because of this heterogeneity? I don't think that is possible necessarily, or it's going to take us a long time to get there, but I don't know, does it send your mind with what you guys were able to accomplish in breaking down those barriers and things? Do you have any thoughts on maybe what your ideal research landscape looks like?
I mean, I think research, like I said, the science, it has to start from somewhere. You know, we need a template or, you know, a guiding point to give us the direction we need to go for the research that will hopefully open doors to more opportunities for treating ALS as a whole. You know, the sporadic, these all like, you know, all the sporadic that we're not being identified, you know, hopefully this through this research, you know, the treatment like Jaci Fusion or you Lefnerson will help treat not just the FUS ALS, you know, genetic mutation, that it will help target all forms of ALS for treatment. That's the ultimate goal, I think, is to find a cure across the board, I guess. Does that make sense? Is that what you were looking to
Yeah.
answer? Okay.
Yeah, no, we love your input. Thank you for that.
Okay. Thanks.
And I think before we close out the research part of like the research specific part here, I mean, the developments we've seen from Tofersen and from Jaci Fuson, the ability to develop ASOs for ALS, we have seen already ASOs go through trial for sporadic ALS. We've had one trial that already went through and closed out, and it's not moving forward. We have a few others that are active today. And so this is how research works. It's not one thing at a time. It's all happening in parallel, if that makes sense. And so we are learning from all of these things like right now at this moment, and it is impacting research today already for all ALS, FTD, beyond. So
I think, sorry, Nadia, I think like, you know, developing an ASO that would be universal for all treatment. I mean, it sounds easy, but I know it's not easy. But I know that I think Huntington's disease is also using ASOs as treatment. So, you know, coming up with a neurodegenerative, you know, it sounds easy, like I said, but if we could just come with a universal treatment, wouldn't it be so nice for that? But, you know, maybe one day. So.
go for it, Lori Andre.
I have a question, and maybe this is just a topic of discussion and there's not one true answer to this, but I'm just wondering, and we've brought up like precision medicine and N of 1 trials. I'm just curious. I know that me and you, Nadia, and Lori Hermstad, because she has a relationship with Dr. Snyder at Columbia, who helped develop the ASO for Jaci. I'm just curious. We've encountered a few researcher clinicians that are on board with this idea of an N of 1 trial. What will it take to convince most clinician researchers that this could be the path forward, to Lori's point about treating en masse, not just specific genetic targets, but really for all people living with this disease?
Yeah, I think it's a great question. I would love to hear from some of our panelists what their thoughts are. But we are seeing a little bit of that happen. We are seeing more customized therapeutics being developed. SOD1 still needs additional therapeutics. We're seeing different types of therapeutic strategies move forward for SOD1 now. And so, I think we are trying to turn the tides with these types of discussions and advocacy and working with the clinicians who are developing these things. For when I was at the Cure VCP conference, I will say like some of the posters that were of most interest to me were allele specific ASOs that were being developed for VCP, right? Because it's really very similar to what we're seeing with some of the other mutations that are relevant to the work that we've been involved in. And so it's happening. I think it's on us to kind of be advocates and push things forward. Michael Wilson, I'd love to hear your thoughts on this. And Brandon, I'd love to hear your thoughts too.
Yeah, I don't know that I could add much to what you've already said. I mean, I know the big hypothesis now, for the vast majority of ALS is the target TPD43. But there's still a lot of unknowns about that. Is it an upstream issue, downstream issue? But I think it's definitely something that we have to focus on. I actually heard earlier today that there's like 8 or 10 companies actually focused on that protein right now. So hopefully we'll get, some answers on that to help people in mass. I don't know if Brandon has much to add to that or but.
Yeah, I think you highlighted a great thing, right? We know that this is a problem throughout 97% of ALS potentially and a big portion of FTD, but at what point do we intervene with TDP43 and how do we learn more about it? Let's hear from you, Brendan.
Yeah, I mean, I totally agree. Like that there needs to be different approaches in how we think about running a clinical trial instead of looking at maybe the clinical presentation as a grouping for cohorts to looking at the disease pathology. And we want it to be as deep as possible, as close to the root as possible. And so part of understanding where the pathologies branch is in having numbers and having research participation from patients and unaffected family members as biological controls. And then the big aspect that I'm not really qualified to speak on is really like the FDA's acceptance of some of these more novel trial designs, and then also in terms of like funding mechanisms, right? Like wanting the science to be strong enough and compelling enough to have a biopharma want to come in and develop it, because that's all of us who don't have like a secret ultra rich uncle, are going to have to rely on biopharma to come in and assist us at some point, and academic research can't do that. So there's a lot of challenges, but like our researchers are working hard. They're like the understanding that FTD ALS is a spectrum, that the fact that there are these shared pathologies open up huge doors to really strengthen the science, to encourage biopharmas to invest and really give us the tools that we need to advocate with the FDA and other regulatory agencies to allow unique trial design. So there's challenges, but there's also really great things we can do to help push forward solutions.
Yeah, I mean, I agree with everything you're saying. I think you bring up really, really strong points. But I think if we look back even like maybe 5, 6 years when we didn't have access to EAPs, right? And what the accessibility now to the EAPs has done is brought our community, and I'm going to throw this term out there, I know a lot of us don't like it, is the hope. Because they feel like at least it's something that they can try, right? But it took advocacy work, and it took awareness, and it took raising money, and then of course it took the passing of Act for ALS. So I do think yes, it will take time. I do think we will get there eventually. The more we talk about it, the more researchers put themselves out there, the more we discover about the disease and biomarkers and whatnot and other mutations. So I think we'll get there. I really do. I think it's going to take time, money, a lot of advocacy, and awareness.
Yeah, absolutely. I think you all hit on major points, right? It's not just about the researcher. I mean, it's not just about the research. It's about the funding. It's about the policy. We need the pathways. And we're for the first time in the last couple of years, we've had some discussion from the FDA about the plausible mechanism pathway that would allow potential approvals for drugs for very rare diseases, and that might allow us to break up ALS and FTD into smaller pieces that would have a regulatory path. And those are the types of things that could encourage investment from different places. But yeah, it's multifactorial and it's very complicated. But we're also in the midst of this. At least these conversations are happening and this research is starting to move forward. Lori Andre, you brought up the hope word. And so I think it's a great time for us to talk a little bit about balancing hope and realism, which is such a crucial part of what we're living through. Michael, do you have thoughts on how do you balance hope and realism in the in this disease?
Yeah, I mean, I think all of us that are living in this space definitely go through all of the experiences, right? They feel the excitement, we feel the disappointment, we see many trials that failed, we see new discoveries, so it's kind of all over the place. I guess I'm realistic in that I don't think there'll be a therapy that'll, help me personally, and I'm at peace with that. But I guess my hope is lying in the research that we are doing today, like all ALS and stuff, is going to answer some questions for the near future generations.
Thank you, Michael. Yeah, the value of natural history studies like all ALS, it can really help us understand so much more about the disease and identify better targets for these medicines and biomarkers that we need critically to advance these types of more personalized treatments. Connie, what are your thoughts on hope and realism? Connie, you're muted, my friend.
Sorry. I mean, I hoped always, I've hoped since I knew this was in our family that there would be something someday that would at least, stop or delay onset or delay the progression. And so fortunately we do have that now, but I mean, it's realistic. We have to be realistic about um where things are, and I'm grateful for the research. I didn't mean to sound like a Debbie Downer about where research is. It felt like it was not happening for so long, and then not that it wasn't happening. I mean, it just felt like forever and ever, and then all of a sudden it seems like it's going at lightning speed for us in a way, or for me, I'll say, because so much has happened, in the last few years, which is amazing. So but now I've, found I have to live in reality, and I just, like we just talked about, it does take a lot of money. It does take a lot of time. It does take a lot of approvals. And that's the part that it's hard. The hope goes down and the reality sets in. But I do believe that, like to Lori Heller's point, that we are going to see something major happen in ALS in our lifetime. I mean, we're already seeing things happen. So I just have to believe, I guess not hope anymore, but just believe something big is going to be coming. So.
Let me ask you this, Connie. Sometimes there's been times where, I think a lot of people would say that I'm not so into hope, but there are times where I send you things and I'm like, Connie, look at this. And you ask critical questions. So where does that come from? You've been at this a very long time, where I think you're one of those people where research means the world to you, but I don't see you easily get excited over random announcements.
Well, throughout all these years of advocacy work and, being part of different orgs and different, we've had, doctors along the way, or we've been told different things and, and then been let down. So it's hard to get your hopes up about things sometimes. And so I try and keep it very, very realistic in those terms. Like, I'm not going to even go there when I'm told something until I see it as facts, or I'm not going to let myself get excited. Even with the Toferson stuff, I'm like, okay, well, we'll wait and see if it really happens, and if it really gets injected, and if it really gets approved for other family to start using it. I'm going to wait to really get excited. So we've just been let down so much in the past over different things. So I want to believe, but I'm always going to wait for the other shoe to drop, unfortunately. That's my own. I'm not speaking for my family. That's just me, just based on past history, unfortunately. But I'm going to keep believing, though. Try and stay positive.
I think you have a very good balance. You definitely keep me balanced in that way. We had a question from Lynn Brellmeyer for Lori Hermstad. He was asking, in what ways did being rural affect your experiences?
Yeah, I think it complicated things. I mean, overall, everything, getting to, getting the critical care that our girls needed to, I mean, travel was a ways away. So it was hard to navigate all those resources to get to the right doctors, to get the right care, to get, as far as like learning everything, but also, the right people knowing how to care for Jason, Alex in there, or Alex mostly, in the critical, scenario she lived in. So it was complicated. It was hard. It was difficult. So yeah, that's something that probably, does need to be addressed, in the future for others.
Absolutely. It makes such a big difference to research access and care access, and then so many other things. We also have a question from Charisse for Connie. She said she's currently participating in an ASO clinical trial, not for SOD1, but based on your family's experience, Connie, is there anything you wish someone had told them before they started?
I mean, it's been in our family for so long, and we've just, I don't, I don't know, because we've always, everybody's just always been participating. So I don't,
Yeah.
I'm trying to think offhand, I guess, because it's just always been passed along. I don't know, Nadia, can you help me think of anything? I mean, I don't know. Is there anything specific, or any of you?
I don't know if there's anything specific, right?
know.
It may just be to move forward and do it. And Lori Hermstad, you may have thoughts as well.
You should definitely do it. I get, yeah, definitely. If there's ever a trial or anything you can participate in my opinion, I definitely think you should participate if you have the opportunity.
So, what was the question again? Sorry, Nadia. I heard ASO in it. Yeah.
Yeah, no, that's okay. It was, what advice would you have for somebody who's just getting started with an ASO trial?
Yeah. Yeah, I'm kind of, I guess, I don't know either. Just, I like how Connie transitioned her words from hope to believe. I really like that, Connie. That's gonna stick with me. You just like, and I think ASOs are the future right now for treatment for a lot, not just ALS, but neurodegenerative diseases across the board. So I think starting that, I think, it's going to provide some opportunity and hope to believe for your future. So
Yeah,
yeah.
definitely participate. That's amazing that they're offering it and you can participate.
Yeah.
Thank you, guys. Lori Heller.
I don't know if you have time for a live question or not, but there is one hand up.
Yeah, we can. Let me see. Okay, Joe, go for it.
Let's see, are you able to hear me?
Yes.
Yes.
Okay, good afternoon. I was just sending you a note, but Farmer Joe is how I'm known in the ALS world in the Philadelphia area. 70-year-old lifelong farmer, limb onset about a year ago, most likely from farm chemicals, but not proven. Slow progression, but starting to speed up. Luckily, very close to Philadelphia, got wonderful care here. We've been to Penn Medicine with Dr. Ellman and everybody at the University of Pennsylvania. We've also seen Dr. Iliev at Jefferson University, waiting to hear from her about getting invited into this latest trial that they're going to be one of 9 sites around the country, which you may have talked about. I couldn't join until about a half hour ago, which is a spinal injection. I'm not sure I'll say yes, but certainly learning about it. But, I can still do a lot, fortunately. And I believe, because I'm a very positive as a farmer, there's no greater risk than putting a seed in the ground, and you got to be positive every day, despite the challenges you face. And so I try and be positive every day. I try and have hope every day. And I read everything I can possibly get my hands on. And I got to believe there's going to be a breakthrough any day now. It's going to support a lot of us. So I just want to say hello and encourage everybody to keep looking forward and do everything we can every day. Thank you.
Thank you so much, Farmer Joe, for sharing your story and for being here. We are grateful, and I think your words were beautiful. And I think we have a few questions that we didn't get to, but we are so grateful to all of you for joining us today. We are over time, so I'm going to respect everybody's time and let everyone go and enjoy the rest of your day. This recording will be available to anyone who wants to go back and see. If you have any questions, feel free to reach out to us at info@northstarals.org. And thank you so much for being here today.